Welcome to Digital Health Talks. Each week, we meet with the healthcare leaders making an immeasurable difference in equity, access, and quality. Hear about what tech is worth investing in and what isn't as we focus on the innovations that deliver. Join Megan Antonelli, Janae Sharp, and Shahid Shah for a weekly no BS deep dive on what's really making an impact in healthcare.
Hi, everyone. Welcome to Health Impact Live Digital Health Talks. Today, I'm excited to have Dr. Yan Chao with us. Dr. Chao is the Global Healthcare Industry Lead at Automation Anywhere. His impressive career includes roles at Amgen and Kaiser, where he's been at the forefront of digital innovation and technology. Today, we're going to explore the transformative impact of AI-powered automation in healthcare. Please join me in welcoming Dr. Yan Chao. Hi, Dr. Chao. How are you?
Thanks, Megan. It's great to be here. Again, actually. And
yes.
We have some interesting things to talk about.
Absolutely. Yeah. I always love speaking with you because I inevitably learn so much about, how healthcare organizations are implementing and using automation. And, we talked for the first time a few years ago. So you guys have been at this for quite a while now. And I know, have seen some amazing results. But it's been so interesting to watch kind of the trajectory of all of this, right? I mean, you were with us at Health Impact, I think in November, or it was January of 23, but, ChatGPT was just sort of on the scene and we were all talking about the impact and the potential. Right. And there was a lot of fear in the room then, a lot of concern. And I think some of that has changed, and the sort of the hype cycle is, maybe we're at the kind of the cresting of that now. But I'd love your perspective on it, having been at this for so long, and sort of what you're seeing with the health systems around the country.
With ChatGPT, the following HIMSS conference, you couldn't walk 20 feet without hearing the word ChatGPT. And of course, now we have Claude, we have Gemini, we have a lot of other things. And that's just sort of exploded, since that time. And I think the reason it exploded is because for the first time in healthcare, doctors and nurses and other folks are seeing that this is a technology that could actually make their work better. As opposed to all the other technologies and regulatory and billing and things, this could actually help their lives. And so there was a lot of excitement early on. But because like any new technology, it was early, there was no guidelines. So people started experimenting. In fact, I heard the early apocryphal story of some physician somewhere who decided to use ChatGPT to appeal a claim denial, and it created a very beautiful document. The only problem was all the citations were fictional, they were not real, and so he got caught for that. But it's part of the early process of trying to figure out what's good and bad about ChatGPT, especially the early version. So we saw a lot of interest especially from academic medical centers, and so because they are able to experiment a bit. And we saw things like pilot projects for a personalized patient after visit summary, which is personalized according to language and culture, educational level, even a neighborhood. You can imagine an after visit summary from a doctor, which I've never gotten, that would say something like, hey, guess what? Your nearest Walgreens is 2.3 miles. You take this bus and your discount is waiting for you there, and you would never see that because it would just take too much work to do that. Now with computers, you can do that. The after visit summary could be rephrased a couple of times for different family members who don't have, who have certain reading levels and things like that. So that was very exciting. Now I see a switch over to some of the concerns about generative AI and AI in general. The first of this month, I think, was the enforcement date for the new European Union AI Act. And that's a very comprehensive effort at comprehensive governance of AI, both responsible AI and other things. I think it's going to be the first of many. And I think obviously there are a lot of concerns with AI and its impact. And we're just at the cusp of figuring out what to do.
Mm-hmm. Yeah, no doubt. And I think, what you said about sort of that, even the patient summary, things that we just couldn't do before, right, as clinicians, being able to sort of do those things and amplify them, and that they are, incredibly useful, right? And valuable to the patient. But at the same time, ensuring their accuracy, and in some case, making sure that they're, the things that we start with are a little bit lower risk, right?
Right.
Tell me a little bit more about what you see in terms of the regulations that are coming, and how organizations can prepare now in terms of what they think may be, impacting certainly here in the U.S., but even abroad.
Well, the whole area of governance of AI is really exploding. A lot of organizations are now trying to figure out, either singly or in groups, to try to figure out what is the right way to deal with AI. And of course, when you do start doing that, there are bad actors and there are good actors. And the bad actors are like the folks that would never follow the nuclear proliferation treaty. Those are the guys. But the good guys are trying to come up with a reasonable way to ensure fairness, transparency, all the good stuff that you want to hit with responsible AI, including sustainability, which I find really interesting. The cost of AI for natural resources is huge. And all the other issues, AI itself has been known to be biased based on biased data. It may be unfair. It may make judgments that are not completely objective. It's based on the studies that go into it. The algorithms are opaque. Sometimes the explainability level is not very high. So you have to ask people to trust in something that, but on the other hand, you look at that and you go, okay, you can't explain it. But if you ask a physician who's been in practice for 40 years and you ask them why they chose a certain medicine, they probably wouldn't be able to tell you. They kind of synthesize all that stuff from their experience, and they just know, from a variety of inputs that's what they would choose. So that's what our comparison is. But I think the whole area of AI is just evolving so fast. Now, on top of that, there are other regulatory drivers, especially for the federal government. The ONC has decided in the last 20 years to really step up its push for data exchange and data liquidity, interoperability between different players in the healthcare system. And that has come across in the form of No Surprises Act, Information Blocking Rule, and a lot of this pricing transparency rules that already hit payers and providers. So what are they to do? The problem is that these rules require you to share data in a fairly comprehensive way. And you can imagine, let's say for Kaiser, which is where I used to work, they have over 12 million patients. Let's say 100 of them decide to come in and get their data. That's the revenue cycle department's job. So they have to get somebody who they don't have, to go and collect this data, including financial data that impacted the care, trying to figure out what it goes in and what doesn't go in, and then have to deliver that within 2-3 days. That's impossible. That is something that, and the same thing goes for the No Surprises Act. Creating the argument for your arbitration requires a lot of manual labor. I don't see people doing that without automation. I mean, it's hopeless. So you want to do it so that when they come in and say, I want my record, you click a button and then they get the record the way it's supposed to be. And I think that's sort of the way that regulation is going. And it's good for the patient. I mean, it's good for visibility into your medical record. You can check it, make sure it's correct. You can shop, for services. That's what the government is pushing, and so on and so forth. So in general, it'd be good, but the implementation is a different question, as it always is. So
right, yeah, and I mean, without, as you said, without automation, it almost, the demands from all different sides are almost impossible. And I think, and we see this sort of push-pull between kind of the risk, the safety, the privacy, the security. I mean, certainly this year we've also seen, a number of breaches. I mean, and a number of, and then there was, even the downtime, disruptions of service and things like that. What are you seeing in terms of applications or even just safeguards that you've been putting in place to kind of combat some of these, sort of, sort of bad actors, and in some cases, not even bad actors. It's just stuff, stuff that happens in the natural course of business.
I have a work laptop, And typically what that means, and I work in a software company, so they should know. So this work laptop is locked down to the utmost. I mean, you can't even send stuff out, things like, which is good, but it makes it inconvenient, right? We haven't quite figured out how to totally protect. Total protection is taking yourself offline. That's a total protection. On top of that, people now are using AI, doing deep fakes and phishing with, people that sound and look just like somebody else. And that's very worrisome. People are using AI to fish out the data, the information, a lot of which is on the dark web, to get access to very sensitive systems. And in particular, I read a really interesting article the other day about Gen AI in particular. It's really hard to safeguard against, really hard, because the prompt is open. You can put whatever you want in there, including sensitive data, and you're asking it to create data, create new data. And I'm not an expert, but apparently that makes it very hard. It's very hard and ultimately, I think that we're probably going to need countervailing AIs. We're going to have to develop AIs that can check other AIs, because humans can't do it. We don't understand what AI is doing. And unless you can, and there are companies trying to work on the explainability of AI, but I see the AI is so valuable. It's going to be hard to say everybody has to be explainable before we can use it. And that is very difficult to do.
Yeah. I just read an article the other day, I think maybe this morning. No, it feels like the other day, but about even how the models now, how you have to be careful of training the models on their own data, because then it can cause model collapse and things like that. So, this gets into the sort of technicality of these models, but, how we then, kind of protect against the evolution of them, and ensure the quality of them throughout is a huge piece of that.
I think when I get calls from young physicians and they ask, what do you recommend I do in the future? Because I don't know what medicine's going to look like. And I tell them, I don't know what it's going to look like, but one thing for sure, you need to look at AI. Three things, AI, automation, and AI, automation, and data science. And if you look at those and you learn something about those, you'll be in good shape. I think all our roles are going to change. When we have AI avatars, we have AI voiceovers, AI content. It's just mind blowing how it's going to change. And so what that means is your role is going to change. And for a physician, what does that mean? When AI can already outperform you in terms of memory, decision making, even maybe judgment in some cases, especially in the imaging fields. What is the role of a physician? Is it to explain it to patients? Is it to take accountability in case the decision is wrong? Things like that.
Yeah. Well, and as you said before, that's some of the acceptance and the excitement around AI has been that the clinicians really do feel like it will help them, right? And so in a world where we have, so much both burnout and job dissatisfaction and sort of just general, unhappiness within the healthcare system, AI does have the potential. But what are you seeing in terms of the actual implementations? Are there real elements of this?
Yeah, there's some interesting stuff going on. Physicians and nurses spend anywhere, depending on scenario, from 20 to 40% of their time on administrative tasks, things that they hate doing. Basically data entry, comparing data, verifying data, checking the checkboxes. And so in my travels, talking to different organizations, anything to relieve burnout usually gets an hearing and gets a hearing, a real hearing. And one of the, besides the typical thing we think of as automation, for instance, summarizing your patient, and so that you can do your summaries and your referrals really fast, or looking at emails to discern content and context so that you can respond to them very quickly and appropriately and not be tired and do the wrong thing. One of the newest things that's happening, and actually the VA put out an RFP for this, is ambient recording using AI. ambient recording is really interesting because it's the idea of a physician walking to a room, talking to the patient, paying full attention to the patient, and you have passive monitoring on the side. And the patient shakes hands. Thank you, Mr. Smith. I'll see you next week. Walks out, and immediately there's a structured summary. And in fact, with later iterations, you could see even that AI could make recommendations during the visit, maybe on a screen, on a wall, things like that. But this is very exciting because it's almost like getting us back to the old model, where the patient and the doctor relationship, the human element is the most important. And we're finding that the human element actually is important to help the patient get better. When they trust a physician, turns out they take the medicine. So it makes sense, kind of, they'll come in for the follow-up. If they don't trust the physician doesn't speak the language, they don't understand what's going on, they won't come back. And then, the estimate is 10% of our hospitalizations in the U.S. are due to non-compliance, which is ridiculous. It's a huge number. So if you can address that in any way, that's going to be better for everybody, including all the quality folks.
Well, and again, it goes to that in some ways low hanging fruit, but also like what was not possible before, right? And so when I think about that, I think about like the social determinants of health. Another thing that there was a sort of a huge hype cycle for like, oh, we're going to use all this data. This is so important. And then the reality of it came back, and the doctor said, how am I going to use all this data? How am I going to collect all of this data? Am I going to, but years ago, yes, a physician would have known, that Mr. Smith lived here, was, married to so-and-so for how many years, had 2 children and lived on a farm or lived in the city, would know all of those things and have that at their disposal. But now AI could make that possible. So it's interesting to think about, what's possible with that and the actions that, could come from it.
The city across the bay from where I live, San Francisco, has over 150 languages. And that, you think about it, today's doctor, they don't know who will walk in. They will, let's say they're a Chinese doctor like myself, and so it could be Hispanic, it could be a South America, it could be Latin American, it could be a European and African. How are you supposed to deal with all the different cultures and cultural beliefs? That's something where AI would be superb at doing. And so I mentioned the after visit summary. I asked Gen AI to generate a patient-specific after visit summary for a Hispanic patient with asthma. And it came up with things like, be careful when you eat salsa and chili because they can trigger asthma. Be careful when you play soccer, not baseball, but soccer, and so on and so forth. Those kind of things I would think, make a lot more sense to people in certain with certain background that they could relate to, and they'll go, oh, this doctor gets me. I think I'll trust this guy. And that's something that it's very hard to do that in 5 minutes. When you only have 5-10 minutes to see a patient, at least the leave behind says that them. You know the culture. You would ask about, AI could prompt you to ask about home remedies, which are very common in Hispanic culture. Could ask about, the kind of where they live. Does it trigger asthma? Things like that. Those kind of things you mentioned as structural determinants of healthcare. Those are the things that we sometimes have access to that data, but I'm sure it would be very helpful if we can get more access to that data.
Right. Yeah, no. And it is, not to say that, it's entirely algorithmic, but there are certainly things that would be, easily trainable for sure. In terms of things that will work and recommendations and that type of thing. So, and it's the human element, but it's also that understanding, it's the empathy, it's those types of things that really make it, there's so much possible. There's so much possibility around the, so we've talked a lot about revenue cycle management and the ability for AI and automation to really save a lot of money for health systems and generate revenue. As we get to some of these softer or more human elements of care, and you're speaking with, health system leaders about adoption and implementation, where are they looking to find the value, from a financial side, and where are you seeing it?
From the revenue cycle perspective, it's been a fairly easy argument because even a study we commissioned, as it was vendor agnostic, people were saying, 500 executives from many different industries were saying that the return was in the multiples, which is really unusual. I mean, 500%, 600%, that's to go from nothing to something. So that's the first step. That's why it's such a large return. Now people realize that, yes, we should use automation across the enterprise, right? In fact, automation could be used to redesign healthcare, but they don't know where to start. I mean, it's hard because every healthcare organization is different, right? Everybody has different specialties. A diabetes clinic like Joslin is very different from a cancer center, things like that. And so where do you start? How do you do it? And we're finding that one of the main challenges today is scalability. How do you scale a program that's may have started in rev cycle or some other area, some business unit, and you take those learnings and how do you persuade other business units, who are not seeing that example in their area, to consider automation? And in a sense, there's a question in innovation change management, which I was an innovator for many years. It's well known to a lot of innovators. How do you persuade, how do you find the early champions who can work with you and are willing to work with you so that you can start to develop the proof points, that kind of thing. And how do you get the funding? How do you do it? Because if you scale, you're talking about the strategic level, that's C-level. And it's not a, business unit problem anymore. It's actually a vision for the company. And sometimes we have that, sometimes we don't. Healthcare is still really early. They see the immediate return from revenue cycle, but there's a lot of potential for regulatory compliance, for burnout reduction, for improving the jobs for thousands of clinicians, for improving the patient experience, as I mentioned. There's so much potential, and a lot of it's not measured in dollars and cents, but indirectly. So if you reduce patient readmissions to the hospital because they're more compliant, you won't get penalized. You won't get penalized by CMS, and you may get a better quality score, which will draw more patients into your hospital, things like that. So working that out, developing the business value framework for that is something we're focusing on. And that seems to resonate with the senior leaderships. But I think we need to do more. We need to really think of healthcare as as something that is now with automation and AI can be changed. In fact, we are still practicing, in some cases, 19th century medicine. And it's interesting, right? So the question is, what do you develop physicians for? When you have automation, you have something doing the work for you. You're not doing the work anymore. So your skills should be managerial in sense. It's not autonomous. I'm the doctor. I lead the team. I do this. So it's a very threatening mindset, actually. So.
Well, yeah, but at the same time, I mean, it is. It goes to that ability to rethink and redesign. What was wrong, I think it makes me think about. EHR implementation and we sort of used this tool to sort of fix this, but, then engineered, sort of the misgivings of that tool into the operations. Right. And we talk a lot about getting rid of the stupid stuff. And it goes back to, literally, how do we model these models to do the things that should be done as opposed to the things we've always been doing. Right.
It's interesting that technology is evolving so fast. I've never seen technology evolve this fast, where science fiction has become reality at a pace that I can't keep up with. And so, can you imagine a physician creating an avatar that looks and sounds just like him or her, that can advise patients, they can talk to patients in conversational AI, they can empathize depending on how the patient looks on the screen, and so on and so forth. That all exists today. And can you imagine 5 years? How can a physician extend themselves to see thousands of patients? You can't, if you're just doing it human face to face. Now, you get a virtual reality headset and you're all set.
Right. But yet, and if we don't figure it out, it will be done. And that's sort of, if you look at sort of how slowly even the regulations around telehealth have been able to be rolled out, and in some cases not rolled out, where there are barriers to that. But, I know I can see on my Instagram account where people are starting to roll out their own
Mm,
avatars doing certain videos, and they're not high quality, but it's happening.
yeah.
And it's certainly, it's all possible. And if healthcare from an administrative and a regulatory perspective can't
Hmm.
keep up with that, it will happen anyway,
Yeah. Yeah. And there'll always be the early adopters in medicine that are going to do it, and they'll make the mistakes, and they'll tease out the triumphs and things like that. So they'll define it. But I think there's quite a few organizations that want to be on the forefront, to be the leaders, and to do the studies. And a lot of them are academic centers. They see this as, can I be the Mayo Clinic of AI? Can I be the leader for the next generation of healthcare? And that's a very noble goal. But I think we haven't even seen the beginning of the potential or the threats. And so I think it'll be an interesting next 5-10 years.
And it is, I mean, it also comes down to kind of the information, right? I mean, the way
Mm-hmm.
people absorb information. And if you think
Mm-hmm.
of, the Mayo Clinic's information, clinical tool, sort of
Mm-hmm.
resources that there are online where you search for that and you find
Right.
those and they're the most
Right.
credible. And there was certainly a period of time where they
Mm-hmm.
always came to the top. But frankly, now there's so many sources that
Yeah.
they don't come
Yeah.
to the top.
Uh-huh.
And, and now with what younger generations are searching for, that they
Mm-hmm.
want the video, they want, I always shut off the
Mm-hmm.
video. I'm like, I just want to read the directions. I don't want to watch the YouTube.
Right.
But my kids certainly don't want
Yeah.
to read it.
Yeah.
And so they want the video. So if we don't, get to that point where it becomes accessible, things that we didn't, weren't possible before because it was difficult, but it's easy
Mm-hmm.
now. And then to go back to your point about translations, to have it in
Right.
every language and
Right.
and make that available to the patients
And
it's such
one
an
of
amazing
one of
opportunity.
the really interesting possibilities is that now people are checking to building their own large language models based on their own data. So in other words, you could be a Common Spirit, a Boston Children's, and you have your unique data from 10 or 20 years, and you have your unique patient population, and your unique capabilities in terms of clinical skills, procedures, technologies, things like that. And then you can actually take that and use AI to optimize it. And that's something now that's possible. And it's within reach, and it was not possible before. So for instance, the organization could find out, what have been doing what have we been doing that's been holding us back? What are we good at? How can we promote that? And things like that, where you can have AI summarize data, all kinds of data across your organization, and actually give you a picture of, how you should proceed. And I think that's something that, we used to have consultants do that for a lot of money. Now it's actually going to be built on massive data troves that you actually keep, and I think that's going to be really interesting, because every organization that's a thought leader will start to use that to really, for instance, here's an example. In June 2023 in Nature, NYU Langone published a study. They used Google's open source BERT LLM to build their own, in-house, so there's no leakage of whatever, in-house AI, Gen AI, to see if they could improve their prediction for database prediction for morbidity and mortality in the hospital. Who's going to die? Who's going to leave? Who's going to come back, in a month? And they looked at their 10 years of data. And the interesting thing was that, and as you would expect, it improved the predictability by anywhere from 5 to 15%, which is huge, to say, this patient you better pay attention to because they're a higher likelihood of dying, in this hospital. But the interesting thing was that they implemented it by looking at the context of the physician's practice. Physician didn't have to enter any prompts. So no prompt engineering. What they did was they actually inferred from the context, this is a patient that could die, and so on and so forth. So to make that prediction, to notify the physicians, all the stakeholders, to pay more attention, and so on and so forth. And so that's the kind of thing where if you use your own data, you can actually analyze yourself and know yourself, and know better how to be better. And I think that's really intriguing. And, we'll see customized AIs all over the place. and they'll be proprietary. They won't be easily exportable, because somebody else has different data. So. And of course, it's still subject to the same warnings about data, that it should be high quality data, verified data, et cetera, and not biased data. But that's really intriguing because now they actually have a much better idea of how to allocate resources, where there's strengths and weaknesses, where they need to address issues, and so on. It's an interesting time.
No, it's fascinating. And I mean, it is. It's sort of, starting with, sort of predictive modeling and the, how we use data from, taking data from data to actual knowledge, right? To the insights, to actionable insights that is possible. You mentioned before, and I'd like to go back to it a little bit around this, just because now when you're thinking about all of this and all the sort of possibility of all of this, and then the scalability of it, you mentioned sustainability briefly. And I'd love to hear a little bit about, because I feel like that's a topic where there's certainly been some initiatives, some discussion around, smart hospitals and the greening of smart hospitals and how do we ensure the sustainability of that. But when you add this whole element of AI, from where you're sitting and you're seeing that power and that, the need for all of that. What is your advice to the health systems as they look at that, and where do you see the future of that going? I mean, how is it going to get managed?
Yeah, AI computing, first of all, requires massive electricity, and it requires a lot of water, which is really interesting. Those two things are the focus of a lot of organizations in this world, apart from healthcare, So healthcare is kind of downstream from that, so hospitals are using this resource, which they have to use. I mean, eventually the competitors will use it, they'll use it. So what's going to happen is that we'll probably have regulatory, control over the cost of computing on our natural resources. But on the other hand, technology is moving very fast. So I'm seeing almost every day developments of algorithms and systems that don't use as much power. So it's a moving target. It's a concern, and it's probably upstream from healthcare. But healthcare should keep it in mind, because healthcare is a big user potentially. We could have millions and millions, hundreds of millions of transactions in AI, just trying to figure out what patients are doing, what's the best thing for them to do. And that is a huge cost to the ecology. So I think it's still, and like everything else in AI, it's still very early, but the early models are getting better. And so there are other issues besides natural resources. There's also things like, as far as responsible AI, who's controlling those natural resources? Where do they come from? Are we going to outsource them to other countries? Are we going to be putting stuff on the moon? Are we going to, there's so much weird stuff going on. Who knows, right? It's like, and then the other worry I have about AI in general is the digital divide. There'll be those that have and those that don't have, so like before, and so like the internet in the early days. So how are we going to address that? And so the good thing is that AI for healthcare is basically going to be behind the scenes, I think, unless you're dealing with patients directly. So patients will notice it, but I think the main effect will be behind the scenes. And so it'll be in sense of invisible.
Mm-hmm. Yeah. No, absolutely. I mean, I think, as all technology should be, right? To sort of create the seamless experience, and it shouldn't be something that you feel too much in that. Well, it's amazing, and it is amazing to think about that. But as you said, with healthcare, it is, sort of, it'll get figured out up here, and then it'll be something to think about, but maybe not something that health systems have to worry about too much in that regard. But so as we have, a few minutes left, tell me a little bit about what you see. It's been a crazy 4 years. What does the next 4 years look like for healthcare? And if that's too far ahead because things are moving too fast, we can just go with 4 to 8 months.
4 to 8 days. Well, I think I think AI-powered, or intelligent automation is here to stay, of course, but it's clearly just the beginning to have the potential to cause a fundamental rewrite of the healthcare landscape. And that's on top of, the technology piece is great, but that's on top of regulatory, consumer trends, world chaos, a lot of things that are going to be affecting healthcare. So I see it as a new world where AI tools are helping workers to be more productive and to do more meaningful work, like we always say. Also helping patients to have more personalized and attentive care. But like any new technology, I think it'll bring a lot of challenges, as I mentioned, both inherent in the technology and external to the technology. And I think ultimately, like the internet, it's going to be invisible. It's going to be something that will be part of our lives. We'll be go shopping for clothes, and then we'll have a phone will tell us, "I think you look better in the green." So we'll say, "Oh, okay." So I mean, it'll be invisible, and we'll accept it. And so we won't ask too much. How did you get that? Except in healthcare, how did you make that decision? But on the other hand, I don't see any way around it. Because it's got such potential. So it's going to be invisible, but it's going to definitely change our lives. And so it's going to be exciting next 4 months.
Yes, and probably even 4 days. No,
Yeah.
it's amazing. And I think sort of that what's possible coupled with, a little bit of, healthcare's reticence for moving forward too fast and managing the risk while we do it, creates, incredible opportunity for improvements in healthcare, which is what we're all about.
Yeah.
Well, thank you so much for being here again, Dr. Chow. It's always a pleasure.
It was a pleasure for me as well.
Yeah, I look forward to chatting again and seeing you soon at an upcoming Health Impact. Thanks, everyone, for joining us on Health Impact, Digital Health Talks, and tune in next time and subscribe below.
Thank you for joining us for this week's Health Impacts Digital Health Talk. Don't miss another podcast. Subscribe at digitalhealthtalks.com. And to join us at our next face-to-face event, visit healthimpactlive.com.